Welcome to the Spark Live webinar series, one component of our Spark Knowledge Mobilization Program. Spark is Children's Healthcare Canada's shared platform for advocacy, research, and knowledge. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live bi-weekly webinar series. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box visible to all of our attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark News e-bulletin by visiting our website at childhealthcan.ca. Hello, everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series. The Spark theme for February is Right-Sizing Health Systems for Children, Community-Based Care for Children and Youth. I'm Paula Robeson, your host for the next hour. I'll begin by acknowledging that Children's Healthcare Canada operates on the traditional and unceded territory of the Algonquin Anishinaabe people. We recognize and deeply appreciate their historic connection to Ottawa. Today, Ottawa is home to Indigenous peoples from across Turtle Island. Children's Healthcare Canada is committed to working toward forging new and deepening existing relationships that include First Nations, Inuit, and Métis peoples, and is grateful for the opportunity to share this land as we work to measurably improve children's health outcomes from coast to coast to coast. We're delighted to be speaking today with Dr. Amy McPherson and Christine Providenza to bring you Let's Talk Disability and Sex, the power of co-creation and knowledge mobilization to meet the needs of preteens with disabilities. This webinar is provided by Children's Healthcare Canada in collaboration with our partner Child Bright Network. I'd like to introduce our speakers for today. Dr. Amy McPherson leads the Profile Lab, promoting an inclusive, healthy lifestyle for everyone in the Bloorview Research Institute, and conducts research addressing the inequities experienced by youth with disabilities in accessing information that supports their health, including the topics of sexuality, eating disorders, body image, and mental health. Amy is committed to ensuring research findings reach key knowledge users and engages in knowledge translation, or KT, activities tailored to scientific community and lay audiences. Christine has a wide range of expertise in research, program, and product development, and experience with and a passion for knowledge translation. Her work is focused on the development, dissemination, and implementation of KT products while using best practices from knowledge translation and implementation science. Christine has various KT products addressing topics including concussion, peer support, weight-related conversations, and sexuality and disability. And her work has engaged and targeted a wide array of audiences such as clients and families, healthcare providers, researchers, and educators. It's now my pleasure to pass the mic to Amy.
Hi there, thanks so much for that welcome, Paula. And I know both Christine and I are thrilled to be here today and talking to you all about certainly a passion project of ours that was wonderfully supported by Child Bright with funding. So yeah, our learning objectives for today are going to be to understand the importance of needs-based, evidence-informed resources, to describe the process for co-creating a resource, which is a book in this case, to meet the needs of preteens with disabilities about sexuality and identity, and to appreciate the complexities of virtual co-creation with youth, parents, researchers, healthcare providers, and educators. Next. Next, please. So I'm going to give you a little bit of a background to sort of the topic and the work. And just to get us all on the same page, we have the World Health Organization definition of sexuality. So we often think that sexuality and sexual health are the same things, but they're actually conflated sort of erroneously. Sexuality is a much broader part of everybody. It's a basic need and can't be kind of separated from other aspects. And it's not just about sort of sex or having sex. It's about our thoughts, feelings, actions, interactions, and it is very closely intertwined with our mental and physical health. Next slide, please, Christine. So some of the things that we include in sexuality are things like how people view themselves and others, how they feel about their body, thinking about diversity and how we respect diversity in across all different issues. And it's around consent and developing healthy relationships. And this includes friendships as well. So really talks about sexuality can start really early in kids' lives, even if that's not what it's called, because we can always be talking about friendships and consent and so on in age-appropriate ways. But the most important part of this is that sexuality is a human right. And this is a human right that obviously many kids with disabilities are not afforded. Next slide, please. So this is problematic because young people with disabilities, have the same hopes and desires for sex and relationship as non-disabled peers that we know through the literature. Something else we know through the literature is that the age of first sexual encounter doesn't differ between kids or young people with and without disabilities. And unfortunately, they're seen as they're desexualized. They're very much seen by society as not being sexual beings or having any sexuality around them. And so because of this, then they're often excluded from getting appropriate information about sexuality as they grow up. And where they do get some information, it's very, very rarely related or tailored to their particular disability. And as you can imagine, with such a wide range of pediatric disabilities, we see in pediatric rehab, then those needs are very different and vast. And so the information really needs to help them understand how it applies to them. But this is generally not included. So youth tell us that they're not getting that information. And as I say, this is sort of very problematic because intimate relationships, however you define that, are very critical components of our mental health. And the idea is around choice, right? So choosing whether to have relationships, choosing what an intimate relationship looks like. Young people with disabilities generally are not offered the information and support they need to make that choice. Next slide, please. So our lab my lab has done quite a lot of research in sexuality and disability and trying to get a lay of the land and what the scope is out there. And we have found there's a huge lack of disability-focused sexuality resources for preteens. And this absence of resources leaves young people with disabilities without knowledge and confidence to safely navigate the world as they grow older. But I want to emphasize that this isn't just about safety. So usually with people with disabilities, the concern is that they're going to be abused. It's about risk. And that is very important. But it's also about where are the discussions of desire and pleasure and all of the other things that intimate relationships give us. So I urge you to think of this not just in the grounds of we're trying to prevent abuse, again, important, but about promoting good sexuality, knowledge, choice, and being able to exercise those rights in a way that is appropriate for each individual. Next slide, please. So this work took place within the context of my lab at Bloorview Research Institute, so the Profile Lab. And as Paula said, we look at many taboo topics or sensitive topics. For some reason, I've just really been drawn to talking about hard things. And so some of those topics have been around, as I say, sexuality, body image, incontinence, social exclusion, and mental health, and so on. So this idea of sexuality really fits within the broader context of my lab that really wants to make information on these topics, these very important topics, available to kids with disabilities as their peers, are able to access their information. Next slide. So again, another piece of context setting is that this book that we're going to talk about today actually is kept within the Disability and Sexuality Resource Hub. That was the brainchild of Christine, who is going to talk in a moment. And we have 6 different areas of the hub that have different resources for different audiences, including healthcare providers, young people, their parents, caregivers, and so on. And I'm not going to talk much more about it because Christine will probably mention it. So I will just sort of pause there, but that's the context of where this kind of lives. We've brought all our research together, as well as other resources that we've identified by doing kind of searches and systematic reviews and so on. And they've all come together in this one hub. So how do we meet the needs of young people, that sort of 9 to 12 age? And this is an important age because generally parents are gatekeepers. So in teens and older, we've heard that, although not ideal, they have access to online resources and they're relatively able to sort of find things themselves. But that younger age is particularly tricky, because it's about how do we get the information to them in an appropriate way, an age-appropriate way, with parents sort of supporting it as well, because parents, are going to be one of the sort of the key educators around this. Often, we would hope we would want to bring the parents along with us. Maybe it's better to put it like that. So, so just one more click, please, Christine. So what we decided to do was create a digital book, so an online book on sexuality, disability, and identity. So a broad kind of idea around how do kids with disabilities see themselves and develop their identity. And this is specifically targeted for preteens. So I'm going to let Christine take over now and explain or describe how we went about this, this ambitious task.
Thanks, Amy. So to help us achieve this goal of creating this accessible book, we put together an amazing team of lived experience collaborators, family leaders, clinicians, knowledge experts, and researchers. So once we established our team, what we did was we proposed a process to execute this work. And this process was finalized by our team, and it involved gathering and prioritizing information, then working together to design and create our product, and then at the end of it all, disseminate this important work that we created together. So what our team did was reviewed a variety of different types of evidence. So this evidence ranged from looking at scoping reviews and clinical practice guidelines and sex education curriculum, to understanding the lived and clinical experiences of the individuals that we've been working with, and based on what we saw in the literature. Key information sources were then identified, and we shared them with our project team. And then from there, we created a list of topics and themes pertaining to sexuality and disability. So the topics and themes we identified were around identity, healthy growth, healthy relationships, and having sex. So the selection and the prioritization of topics was completed through virtual team meetings. And essentially, the team decided to work on one book focusing on the topic of identity. Originally, we had thought we would be able to create a series of books, but in reflecting on the complexity of the topic of sexuality and disability and the scope of the work, we've decided to pivot and to focus our energies on creating one book focused on identity. So together, as a team, we then started to generate key messages. Now, the creation of a book was selected as the medium to convey our disability-specific messages, and we landed on creating a book through a consultation process. The end result was an accessible book, accessible in terms of creating a PDF that had accessible language, an accessible color scheme, images, and design, as well as creating a video that was in a narrated format. So designing and creating the book really involved bringing different partners together. So for example, we worked with our knowledge experts and a professional writer to develop content for the book and really ensure that the writing used youth-friendly language. With the help of a graphic designer, an appealing look and feel was created using inclusive images and creating an accessible design. We also worked with a multimedia expert to create a video for the book, which was narrated by an actor, a young adult with a disability. And then we also worked with our website developer to ensure that the book was properly profiled on the website. Now, the PDF version of the book, as well as a narrated book, can be accessed by visiting hollandbloorview.ca/sexuality-books. So the book is listed as a resource as part of the broader Let's Talk Disability and Sex online hub. And in addition to the book, the hub consists of a variety of other resources, and as Amy mentioned, is part of a larger research initiative that's being led by the Profile Lab at the Bloorview Research Institute. So now I'm going to talk a little bit about the dissemination efforts for the book. So in terms of our efforts, we have been extremely fortunate to be able to collaborate with our in-house communications and public engagement team to help push the word. So this included using social media and media channels, launching a bookmark strategy as part of our awareness campaign, as well as uptake from trade publications such as the Ontario Health Association's Hospital System News. We also partnered with organizations such as Empowered Kids Ontario to help us spread the word. Now, as we've been pushing out the word, we've also been getting some pull opportunities. So for example, we received requests for permission from Erin Oak Kids, as well as the Pediatric Surgical Associates, which is located in Minnesota, and their expertise focuses on the spinal bifida population. And this was to print out the book and to give it to their clients. We've also come across some really unique opportunities which arose whereby us reaching out, they said, yes, please. So for example, we connected with the Toronto Public Library and we received requests to provide bookmarks to all 102 branches in the city of Toronto. We also were part of Pride Toronto's community outreach campaign, where we handed out bookmarks as part of Pride Toronto events. As of late, we've also received requests from parents for the book, whereby we've directed them to the website for them to access their own free copies. So the book was officially launched on March 28th in 2023. And as I mentioned, we use a variety of different platforms to profile the book. So you can see here a bit of a snapshot of some of the work that went into launching the book. We also were able to organize a booster pitch for the book during Pride Month in June 2023. So in terms of reach, with the launch in March 2023, there had been 439 downloads of the PDF and 199 views of the video. And as Amy and I mentioned earlier, the book is situated within the Let's Talk Disability and Sex online hub. So you can see the traffic that the hub gets with 401 page visits, and that was back in 2022, and the hub was launched in the fall of 2022. And then for the year of 2023, you can see there's been quite a lot of traffic at the hub with just over 1,700 page visits. We've also had international reach of the hub and the book with over 35 countries across the globe accessing this work. I'm going to pass it over to Amy to talk about some considerations.
Thanks, Christine. If you could just advance the slide, thank you. So as with this project, or a lot of projects, we had some challenges, but we also came up with some solutions as well. We had to be creative sometimes. And as you can imagine, sexuality is a hugely complex topic. We had grand aspirations at first. We said, we're going to do 4 books and we're going to do this and that. And then we quickly realized that that really wasn't going to allow us to create really good quality materials in sort of the year timeline that we had with the monetary resources we had as well. So we were able to narrow the project scope to focus on one book, sort of just addressing one topic, although it's a broad topic, identity. But we did that with our project partners. So our youth collaborators, our parent collaborators, and so on. So they really prioritized what was most important for them, and we followed their lead when we were narrowing the scope. So time and resources, there was that little thing called COVID that happened right when we were starting. And so a lot of it was done, we had to do everything pretty much virtually. And this did extend our timelines. But Charles Bright was extremely thoughtful and allowed us to have a slightly extended timeline. So we were really able to do a really good job with this, go through all of our processes without compromising sort of the budget and the rigor of the process we want to do. So thank you to Charles Bright for your flexibility there. We had amazing lived experience collaborators, some youth, some parents. But, with the youth, they were full-time students, parents had jobs and children and life that went on. And so, we couldn't just quickly schedule meetings, because they had very busy lives. But we were really trying to be flexible as possible to accommodate schedules. And if we couldn't get everyone together, we made sure that we kind of did loop backs with the other people who couldn't attend and make sure that everyone felt part of the process and part of the community, the decisions and communications. And then, yes, the pandemic also meant that our clinical partners had many other clinical priorities in this time, understandably so. And so having that extra time was allowed us to have really meaningful consultation with them rather than just sort of paying lip service to, oh yeah, we've got this list of people that helped us create it, but didn't. So these were some of kind of some of our learnings and some of our challenges that we experienced. Next slide, please, Christine. So what helped us to really make this book kind of really high quality, following rigorous processes and be really sort of usable? So we're very lucky at Holland Bloorview that we have a communications and public engagement team, and that allowed us access to graphic design and multimedia and communications experts. And this was particularly important in sort of our graphic design partners, that they, understood the AODA guidelines and that they could make sure all of our product was accessible from many different standpoints. So from sort of not just like does a screen reader work on it, but say colors, contrasts, images, amount of white space, the words we then used and they kind of turned into graphics. So that was a considerable facilitator for us. This book actually came on the back of a 1.5, 2-year project looking at sexuality and connecting with people across Canada, healthcare providers, parents and youth across Canada. So we had an existing network that we could draw upon to really get experts to help us with this. And when I say experts, I mean across the board. So youth, parents, healthcare providers, researchers, educators, and so on. So we were lucky to be able to kind of utilize our network that way. Holland Bloorview also has a youth advisory council, which is all former patients or clients of Holland Bloorview. and also a research family engagement committee. And these are all parents or caregivers of children who have or are clients of Holland Bloorview. And we can consult both of those places for feedback and input. And we were very lucky to be able to use sort of those opportunities to say, you know, what do you think about this? How should we position that? Is this something you'd be interested in? Are there any red flags for you, you know, with this? What do you think of these graphics? Are they too young? You know, so we were really able to kind of really test out things with our lived experience experts across the team and across the hospital. And so Holland Bloorview has the Evidence to Care team, which is the knowledge translation hub at Holland Bloorview. And so we were really able to make sure we had KT best practices, you know, throughout the creation of this project. And that is largely Christine, who is an absolute amazing knowledge translation expert. And so she was really able to ensure we kept all of our best practices throughout, and we did things really thoughtfully and following best practices. And then another facilitator was in-kind support. So basically Christine and I were the PIs, but this took a lot of time, a lot of our time. And as I say, this was our passion project, so we gave it willingly. But, you know, we wanted to highlight that these are sometimes the things that we don't think about when we're planning projects. And so we just wanted to raise that sort of resource, or that in-kind resource or resources was really critical to getting this done. Next slide, please. So when we thought about what we had done and what we would do again and what we would recommend other people doing, because, you know, we learned a whole ton along the way of doing this, from our early ambitious heady initial days to what it took to get this done and have a really quality product at the end. We really would encourage people to ensure like the scope of work, the deliverables and the budget are appropriate and realistic. Christine is excellent about raising when we start doing scope creep, because I think all of us, as we get excited and we start talking about a project, and then suddenly it gets bigger and bigger and bigger and bigger, and everyone's super enthusiastic, and then all of a sudden you're not sure how to, you know, design the deliverables and achieve everything within, you know, the scope of this particular work or this project. So that was really important. And again, our collaborators, our lived experience collaborators on our team really helped with us to kind of really prioritize and highlight the things that were important for them. Again, bringing on partners with different knowledge and expertise early on. So, you know, one critique we often hear is that, you know, researchers go and get the money and design the project, and then ask people to join in and say, oh, we've designed the project, but parents, can you help us? Or young people, can you help us? So bringing them on really early is like critical, so that things truly are co-designed, and it's not just a sort of a one way where, you know, the researchers have decided what they want to do, and then they expect other people to do it. So we really wanted to make sure this was co-created truly, and that does have, as I say, in the considerations, that does take time, but it's so important. And then our last recommendation is to create a structured but nimble work plan. You know, I don't think any of us had planned for a pandemic back at the end of 2019. And yet we had to really think, how can we be nimble with our goals and outcomes and deliverables, that, you know, we could be flexible. And again, taking some extra time really benefited us with that. But working that into work plans in advance, you know, would have made that a lot less stressful, easier, whatever the word is, but being able to have various different, like plan A, plan B, you know, plan C, can really help to sort of shift and change in a nimble way. So I think the next slide is our references. So that was a quick gallop through our project. Designing the book for sexuality, and then that is the hub, and you'll find the book in the books section, books and infographics section. And you can find lots of other things. So, for example, we have one-pagers as well for parents and healthcare providers, like conversation starters and words to use, words to avoid, and things like that. So please do feel free to visit and have a good old dig around and see if there are some things that might be helpful for your practice. And just a little plug. So I'm leading another project which is called We Are Sexual Too. And it's a knowledge mobilization project. So across Canada, we're connecting organizations and researchers who specialize in sexuality, sexual health, or disability, and connecting the two, because we've heard so much that people like Planned Parenthood and organizations that provide sort of sexuality support information often aren't well versed in some of the specifics around disability and those needs, and vice versa. Some of our disability organizations are always like, help, if anyone approaches them asking for sexuality information. So this is a 3-year project funded by SHIRC, the Social Sciences and Humanities Council. And one part of this is our Knowledge Network of Expertise in Disability and Sexuality, or NEDS, as it's known in our team. We're doing a series of webinars, and our next webinar is coming up on March 19th. And it's called Disability and Dating in the Digital Age. We have an amazing student who's going to come and talk about her research about disability websites, or dating websites for people with disabilities. And so we absolutely invite you to come and join us. Hopefully someone's going to put the registration link in the chat for you if you would like to join us. But I think it's going to be a fun and interesting and insightful hour. So please feel free to join us if that would be of interest to you, and carry on this conversation about sexuality and disability. Thank you so much.
Thank you so much, Amy and Christine. Great discussion. Certainly an issue of equity that's on folks' minds so much lately, but equity from a disability perspective. I see our audience members have questions, and I'm going to take a moment to get them sorted. While I'm doing that, Logan will launch another set of polls. You have to answer all the questions before submitting a response. While you're doing that, I've got a couple of questions, and this is my cue to the audience. If you have any last-minute questions, type them away. What would you do differently if you had it to do over again? There's always things we learn along the way. Is there something, A, that you are especially proud of, and B, something you would do differently?
Maybe I'll do the proud of, and I'll pass to Christine for something we do differently, because she's the knowledge translation brains behind the operations. I think I'm really proud that this was truly created with our lived experience collaborators. We spent many hours on Zoom meetings with our 2 youth collaborators, actually just writing. One of us was typing, or one of us was coming up with content. And then when we brought on our professional writer, again, they met with the lived experience collaborators as well. So I'm really proud that they were really an integral part of creating this resource. So it's, for youth with disabilities from 2 people who have lived it, and they were able to share what they wish they had known. So I'm particularly proud of that piece. Christine, thoughts on doing differently?
I think, as Amy mentioned during our presentations, in terms of the considerations, these were things that kind of bubbled up as we were working on the book. And I think, in looking back, there were so many things that we wanted to do, and we were very excited to be working on them. And our eyes were very big. So I think potentially doing a little bit more initial consultation as we were scoping out the project would have been really valuable to help us focus our efforts even more as we were designing the work. Because I don't think we realized it that our scope was so big as we were designing these efforts, and that became even more apparent, apparent as some other constraints and parameters were presenting themselves as we were working on the project.
Isn't that always the way? As part of the co-design process, are there any approaches that you would recommend others to follow? Did you have a standard step-by-step process? Did you sort of go by the lead of your youth advisors?
I would say that we did all of the above. So definitely looked to the literature to help inform our engagement processes, and also really talking to our partners and our collaborators in terms of how they saw themselves as part of the work, how they would like to be best engaged, what roles they would like to play. We established those roles together as a team. We really wanted to make sure that we were truly listening to all the people who are part of the work and we're meeting their needs as part of the co-creation process.
Mm-hmm. I would add, I 100% agree with that, Christine, but it also highlighted we had to be the leaders at the same time because they had many other priorities. So they were really looking to us to create sort of a structure or processes where they could provide their input, but it wasn't relying on them doing sort of moving the work forward. So we really did work hand in hand in us creating sort of the structures and the processes, and then that enabled them to really bring their experience and what they wanted to contribute to the project while still moving ahead to meet our timeline. So yeah, it was definitely a hand in hand process there.
Oh, wonderful. Any lessons learned around youth engagement in this? Lots of folks are involved in youth engagement from a variety of different topic areas and clinical programs and a variety of other sort of variables. Any particular learnings you could share with the group around youth engagement?
At the risk of sounding repetitive, is about time. Really taking enough and giving enough time. As academics, we unfortunately do a lot of things at the last minute, and that just doesn't fly when you're trying to meaningfully collaborate with lived experience collaborators. And so it is around like really looking at what do we need to achieve and by when, and really allowing a time for them to meaningfully contribute, rather than sending them something and sort of expecting them to rubber stamp it by 2 days time or something like that, which is often researchers are critiqued for, and so I think that was one thought.
Oh, brilliant. Lorraine has asked, how have you envisioned the use of this resource for preteens and parents to review together, part of a teaching group for preteens to learn together?
So we definitely recognize that parents have a big role here, as I think I mentioned earlier. And we did envision this as something that youth and parents could look at together. And we're also aware from talking to lots of parents that sometimes they feel a bit like, oh, I don't know what the latest words are, or I don't know enough about this, or, whether embarrassed or reluctant, or just feel sort of that they don't have the knowledge. So we've tried to really provide that knowledge, not only for the youth reading these books, but also to learn alongside parents, so the parents can kind of understand contemporary language and some of the things that their children may or may not be kind of hearing about or learning about. So definitely, again, a sort of a dual approach. We want to do some library readings, sort of like book readings that we have with other books, and we would invite youth and parents. We were trying to figure out, would we do them separately, together? But certainly given the age, whilst we want to empower younger people and younger kids, we also recognize that much of this goes through parents. And so it's important to try and provide those opportunities for both. But we are definitely open to ideas as well. So if anyone has a great idea about doing this, then please do feel free to let us know. Would you add anything, Christine?
No, I think you captured it really well, Amy. I think, the other thing to also mention is that on the hub, we have some other resources that are there for parents that are conversation starters and words to use when having conversations. So that can be like a really nice complement to reviewing the book and thinking about how to have these conversations with children.
It's not always an easy conversation for parents, regardless of who the little people are in front of them. So any support, I'm sure parents truly appreciate. One more question from Megan.
Yes.
As a mom of a child with disability, based on your work, what advice would you offer in broaching the topic with her child? Her son is 11 and doesn't want to talk about it with his mom.
So weird, hey? I don't know why that would happen. Yeah. Thanks, Megan.
Your son is not unusual.
Comment. Yeah. I had a little chuckle there. So I think my advice is not to talk about it. And what I mean by that is don't make it about sex. So the conversations might be about sort of friendships, maybe at first,
Right.
What makes a good friend? How would you like to feel if you're friends with someone? Oh, do you think that was something a friend would do? So using everyday life to bring in some of these building blocks. Poor Christine's heard me say this so many times, these foundational building blocks. That we start from very young, it's about even things like naming parts of the body using, proper names, talking about touch and inappropriate touch, talking about, pleasure or privacy, consent. But all of these things can be done in an age appropriate or cognitively appropriate way. And so, Megan, I would sort of try to use everyday events to talk about some of these concepts that will hopefully provide a good foundation for your 11-year-old as he grows older and has these experiences, and just being super open about things so that he knows he can come to you if he needs to. I know it's really tempting. I remember my mum and dad teasing me so badly when I was interested in someone, I wanted to date someone, I had a crush. And that, I think it's tempting to do that because it feels kind of, funny. But even just really taking things seriously like that and just being super open and, kind of like, oh, okay, well, why do you like her or him, or just when you're watching TV, commenting on relationships on the TV or, things like that. So rather than making your poor son, Megan, sit down and talk to you about sex, you might want to try and be creative with some everyday things. I don't know if that's helpful.
Wise words for any parent. Our last question is from Genevieve, who's, do you have any recommendations specifically on educational guidelines to follow when creating educational resources on complex topics for use by individuals with intellectual disabilities?
Great question. There's actually quite a bit more written on intellectual disabilities and sexuality than sort of more of the physical disability side, which is interesting and could be a whole other talk. Right off the top of my head, I'm not sure, but I can definitely have a think for Genevieve and see if we can come up with anything in our files, our networks that might be helpful for that. There's any kind of regular design guidelines are really important, and accessibility in terms of just what we talked about earlier, spacing, colors, and so language, and the images used as well, so that people actually see themselves in the book. And I think we forgot to say this when we were working with our designer to create the illustrations for our book. We really wanted to have the readers see themselves in the book, because some of the information there is a lot of it is relevant for any kid, to be honest. But often the images are not representative, and so when we wanted to design a product tailored for that, we have to think about not just the words we use, but also what are we presenting in terms of what people are seeing in there as well.
Fair.
Just to add to what Amy was saying, I think it could also be helpful to look to the literature about the development of education resources for individuals with intellectual and developmental disabilities to understand learning approaches that are suitable, which might also help how you create the education resource in alignment with connecting with individuals with intellectual and developmental disabilities to understand what their needs are and how they like to learn. So I think it's looking at a variety of different aspects of the literature to help inform the creation of your resource.
Yeah, thanks, Christine. And that's another big strength that Christine brings with her role as well, to bring all of this kind of not just theory, but the sort of best practices from the literature when creating things like this.
It's wonderful as well. Have you connected with the Canadian Children's Literacy Foundation? They provide literature in hospital, outside of hospital, around a variety of different topics, and your booklet may be of great interest to them as they go around as well.
No,
I'll share you the link.
Yeah, that would be wonderful. We have connected with other organizations. So, for example, CCAN, which is the Sex Information and Education Council of Canada. I always call them just CCAN.
Alphabet soup is
So again, it's about also, I think, connecting with other organizations that talk about sexuality, sexual health, things like that, sexual rights. And that's what we're trying to do in our sort of latest project, is to build those connections. So yes, but that sounds a great addition to our network. So we'd love to learn more about them. Thanks.
No worries. Thank you so much. As someone who's been in knowledge translation mobilization for what it feels like a million years, I really appreciate the integrated knowledge translation approach that you took, the involvement of folks right from the beginning, helping to shape this project right from the beginning and all the way through, and your efforts have resulted in a lovely resource that would be useful for talking sex and disability, but it sounds like it would have some tidbits for any family.
Absolutely.
So that's the end of our time together today. Thank you both, Amy and Christine, for sharing your time and expertise with us. And thanks to our audience members for joining in. We know how busy everyone is, and we appreciate you taking the time. We have a PACS. Go ahead.
Sorry, I was going to say, please feel free for anyone here to reach out to either of us if you have any questions. I'm sure that can be facilitated through Charlie.
Absolutely. Let us know, and we can make sure that happens. We've got a PACS schedule coming up here at Children's Healthcare Canada in February still, although it feels like we're almost at the end of the month. On the 26th, our next episode of Spark Conversations, our podcast series, is coming up, and check in on your favorite platform to listen to a pediatric student-led clinic, one model to help right-size children's healthcare, where Kirsten McMaster will be in conversation with our podcast host, Dr. Catherine Smart. And on February 28th, tune in for Spark Live webinars for Youth in Pain, Solutions for Effective, Safe, and Equitable Medical Use of Opioids for Pain in Youth, being co-hosted with our partners, Solutions for Kids in Pain. And in March, we have a child health equity system-focused learning series coming up, delivered over 3 days. March 7th will focus on equity in healthcare service delivery. March 21st, we'll focus on child health research and equity related to that. And March 28th, we'll take a focus on equitable child health policies. As well, we have a save the date out for our conference, an annual conference in October 2024 from the 20th to the 22nd in St. John's, Newfoundland, and it'll be co-hosted with our partners, Janeway Children's Hospital Foundation. It's always great if you can watch as your questions and comments enrich the discussion. But if you can't, the recordings of these sessions are made available after the fact on our website. Thanks for joining today. Thanks to our wonderful speakers for this presentation, and hopefully we'll see many of you back here soon. Bye, everyone.